I'm going
Go
to
on top
surveys.
surveys, yes.
Yes, I'm going to surveys now. So before we go into tying up the portfolio, there are other areas that we need to talk about. And I will just call them multi-source feedback. It's called MSF. So you will hear MSF. And around this time, around May, June, July, you see people, everyone is running around, approaching staff, smiling more with staff so they can get their MSF done. So what is MSF? MSF is called multi-source feedback. It's a way of getting feedback on your work and on your performance from different people at work. So it's on the right side of the portfolio page. And let's see. So you just click on this, and this is colleague feedback. So if you wanted to start your feedback, you click on start a new feedback. Okay? There are different types of feedback. We have colleague and we have patient. Patient feedback is also something called patient satisfaction questionnaire. That is done in your final year of training, and I will talk about that. Let's talk about colleague feedback. So you want to start a colleague feedback, you click on it, colleagues. So you have your supervisor who would review your feedback. Most times, some people used to send it to their clinical supervisor, but I think it should go to your educational supervisor, but it depends. First of all, there are different things you need to do here. You will complete a self-assessment. If you click on it, there are different questions. So it's more like you assessing yourself on how you feel you have done. Okay? By the way, these are the same questions that the people you are sending the feedback to will get. So the feedback, the colleague feedback at the end of it will compare your own assessment with the assessment of your assessors, if that makes sense. So first of all, you complete your self-assessment. As you can see, you will comment on your professional behavior, you will comment on your clinical performance. It's quite short. When you do that, you go back. This place is now ticked. Then you should add at least 10 colleagues. There's something I need to mention here. Until you add 10 colleagues, the feedback will not go out. So that's why most times people collect up to at least 10 names before they send it out. The idea is to have those 10 names, send it out, and then you can keep adding more. Now, as you can see here where my cursor is, we have clinical and non-clinical. So you are usually advised to have a good spread. For example, if you have worked on the ward for 6 months, the ward has ward clerks. You may not have so many non-clinical in the ward, but you have the ward clerks, you have some admin staff that come around to the ward. Some people have rota coordinators office in the ward. Those people can qualify as non-clinical. So in hospital, if for example you have 7 clinical, 3 non-clinical, no one would really bat an eyelid because they know it's hospital rotation. It might be difficult, but always try to have a good spread. Another thing that is being clamped down on is giving your colleagues alone your MSF. So you see clinical, you have 7 clinical, and all of them are GP registrars. Let me give an example. When I was in my second year of GP training, I did an MSF and I sent it, completed, closed, I sent it out, sent it to my supervisor, and he rejected the MSF. Why? He said he did not have a lot of GP, GP spread, and that your colleagues cannot give you this was his opinion, that your colleagues cannot give you an unbiased opinion of your practice. So we had to reopen the MSF, and because the practice I was in, there were challenges because it was a very big practice with like 5 sites. So some of the GPs, I didn't know them. So what happened was he now had to help by sending an email to all the GP partners saying, if any GP registrar, even if you debrief them once and they send you an MSF, please complete an MSF. So I had to redo the MSF, not redo, add more GPs, and then it was accepted, and that was fine. So what I would advise is, if you have been in a rotation for about a month or 2, you've gotten your fitting, you've seen people you're friendly with, open your MSF and send to have a diverse distribution. For example, let me use the geriatrics ward. In the ward, you have occupational therapists who come to the ward every day. You have pharmacists who come. You have physiotherapists who come. You have the nurses. You have your consultants. So you have different people that if you are more settled in the rotation, let's say maybe your second to third month, you can give them MSF. Because it's not just giving them MSF, you have to chase them to complete it. So the more diverse your population is, the better. And obviously, because MSF is your feedback, you are choosing who to give MSF. So although you cannot decide what they would put down for you, you also wouldn't give an MSF to someone you have not spoken to before, for example. So you are the one determining who you're giving MSF. So choose wisely. That's the word that we use. Now, if you're giving an MSF in a GP practice, a GP practice has receptionists, secretaries. Some GPs even have GP admin. So I have noticed that most supervisors are less forgiving if you don't have an equal number or an almost equal number of non-clinical staff, because they are quite a number. I would use the practice I came from. We have like 20 receptionists. We have like 7 secretaries. So if you have an MSF where you have 7 clinical staff and 3 non-clinical, your supervisor has a right to say, does it mean you stayed here 6 months and you don't even have 5 non-clinical staff that you said hello to? So that's why the GP world is different from hospital. It's like a team. So you come into work, you say hello to everyone. In fact, in my GP practice, we have a back door, but I used to deliberately go in through the front door so I could just say hello to because the front door has the reception, the pharmacy admin, and all that. So I would go in through the front door. Although I had the code to the back door, I would go in through the front door and say, hi, good morning, how are you? Because that's what they will remember when you give them your MSF. Okay, so these are things that will make it easier. And then at times, if they're talking about something interesting and you're passing, hi, how was most discussions center around the weather? Oh my, before you know it, you see that the pressure of sending out an MSF is not as bad as it is, because you're friendly with everybody, and then they tend to remember you or help your MSF. So the point I'm trying to say is, don't put yourself in hot water by having more of non-clinical. Open your MSF early, because you may need to chase them around and remind them to fill it. And that makes it. Once you have 10, you can close. If you feel you don't have a good mix yet, then you can leave it open till you have a good mix and you close it. Once you enter your 3rd year of training, when you open this, what you will see is colleague, leadership, patient. That's why I said it's good to do your QIP in your 2nd year, because there's quite a lot in your 3rd year. So in your 3rd year, you're going to do a colleague feedback, colleague MSF, you're going to do a leadership MSF, and you're going to do a PSQ. PSQ is called Patient Satisfaction Questionnaire. The leadership is not here because this is not the portfolio of a GP registrar in the 3rd year. So for the leadership part, remember I talked about leadership activity. So most people, they use that leadership activity to get their leadership MSF done. For example, if your leadership activity was chairing a practice meeting, you can chair the practice meeting, write it up as your leadership activity, and send out the MSF then. For me, I said I did some presentations, some teaching sessions to pharmacists and to paramedics in my practice. So after the teaching sessions, I told them that I will send you an MSF. Please help me fill it in. But because my presentations were to clinical staff, I also sent out leadership MSF to other people I had discussed my QIA with. So the practice manager, the data controller in the practice, the secretaries, the people I discussed my QIA with, I told them, because of this discussion is more of a leadership thing, I will send you leadership MSF. So that is in your 3rd year. So you can imagine the things you need to do in your 3rd year. So that is for colleague, and that is for leadership. Leadership too, you also need to have 10 before you can close it. For patients, I'll just open it to just show you a demo. This is opened only in your 3rd year. It's the same thing. You complete your self-assessment, you click it in. This is different. You just complete the questions about the patient. These are the same questions that will be given to the patient. So it compares how you viewed yourself with how the patient viewed themselves. Once you complete that, You now add patients. Now, this is where you decide what you want to do. If you look at it, it is to obtain at least 34 patient responses. So it's quite a number to complete. Remember, this is done in your third year, so you will have a lot more opportunities to get this explanation. You can add patients' emails, you can hand out the link, or you can print out paper questionnaires. For me, for my patients' feedback, I used patient emails. So what I would do is, after every consultation, I would ask the patient, are you happy? Sorry, I didn't use emails, I used their phone numbers. I'll ask the patient, are you happy for me to send you a feedback on this consultation? They say yes. I put their name, I put their surname, I put their phone number there and then, because I don't want them to forget. So I do it and I tell them it's in your phone. The downside with using their phone numbers is that you may lose some patient population. Like there are some older patients that don't know how to fill things online. So if you're using this method, I would advise start it early, because it's not everyone that will say they will know how to fill it. Okay. But that was what I did. And within 4 weeks or so, I was able to get my 34 responses. For some people, you can get their emails. I'm still on number 2. You can get their emails and hand out the link. So you can ask them, can I get your emails? If they say yes, you can get their emails and then you invite them. When you invite them, they get a link and they fill in. You can do that. And then for some others, which some people also do, you can print out the questionnaires for the patients to complete. Now, in this case, there's something I would mention here, because some people have got into hot water for this. You do not fill the questionnaire yourself, because you cannot be filling the questionnaire for a patient's feedback about your own performance, because no one is quite sure whether you altered what the patient said. So what some people do is they print out the questionnaires and they drop it at reception. You can also have a chat with an admin staff, okay, who can fill it in for the patient. As in, you can also have a chat with an admin staff who collects the paper from the patient when they drop it in and fill it into your portfolio for you. You should not have any business filling it in to your portfolio. You should not have any business filling the form for the patient. Some people have done it this way, and that's what they did. So if you look at number 4, it says, if relevant, send any paper surveys to your admin team for entering. So what some people do is they print out maybe 50, they drop it at the front desk. When you finish seeing a patient, they tell the patient, please pick up the questionnaire at the front desk and then return it to the front desk when you have filled. When it is returned to the front desk, it is given to the admin staff that you have discussed with, who is helping you, and then you give the admin access to your portfolio, and then they will go and enter it in. So it all depends on the method you want to use, but these are the surveys you need in GP training. In your first year and your second year, you need your colleague feedback, which should be evenly distributed between non-clinical and clinical. In your final year, you need your colleague feedback, you need your leadership, which will appear in this middle once you enter your third year, and you need your patient feedback. So that's it about surveys.